discuss today. Welcome as everyone comes in. I'm just going to start by giving a little bit of background about Black Women Benefit. Well, Black Women Benefit began in 2020, really at the height of Breonna Taylor's tragic murder and also Toyin Salu's tragic murder. It really began with the vision that we do not hear our outcomes enough, and that has to stop. And so the ideation behind that is that we would like to create an organization that embraces, empowers, and invests into all Black women. And so the ways that we have created to do that have been to do certain programs like town halls like this, mental health cohorts, because as we know, we tend to have worse outcomes when it comes to our mental health as well as all most health. But yeah, that's a little bit about us. So.
Awesome. So I'm Leah. I am the Director of Communications and Marketing for Black Women Benefit, and I'm so happy to be here. This has been a labor of love. I am a Black mama, so yeah, all the struggles are my struggles too. And I've been wanting to do something like this for so long, and I'm so glad that we have an amazing group of panels, just people that are doing such great work in this space. And I'm just so happy to have them here. I'm so thankful that they agreed to spend their Friday evening here with us talking about these things. So I want to get started. I want to allow all of our panelists to introduce themselves, where they work, and what the work that they're currently working.
Sure. Hi, everyone. My name's Austin Van Greck. I'm a program coordinator with Young Mothers, Inc. I'm a volunteer for the organization. So YMI is really focused on providing education, mentoring, resources, and support to young moms in the DMV, specifically young moms under the age of 21. So we have a bunch of different programs that we run, from business development kind of programs, teaching women skills on how to start their own business. We just did one that focused on IT careers and how you can easily break into that. We also have some programs focusing on mental health, so really providing a community for these young moms to connect with others and feel supported and provide them with that support. We also have done some COVID-related opportunities. So we did some fundraising during COVID and really polled our moms to see what the biggest need was, and focused our energy there. So providing groceries, housing help, all of those things as well. That's kind of our general overview. I don't know how much detail we have time for, so I'll stop there.
Thank you, Austin. Anna, would you like to go next?
Of course. Good evening, everyone. I want to first thank Black Women Benefit for the invitation to sit on this panel. I'm very excited to join in this capacity. My name is Anna Rodney. I am the Executive Director and founder of MOMCares. MOMCares is a doula organization that supports Black mothers in particular here in Baltimore City, who are navigating high-risk pregnancy and or NICU involvement after a traumatic birth outcome. We do a number of things, again, similarly hosting panels and discussions, healing circles in the community, also training and workshops for medical providers and community organizations around bias and the Black maternal health situation. Right now, we also do one-to-one service. Each of our moms gets a free doula for the duration of their pregnancy and then into their postpartum period. As a part of that, we do deliveries, so diapers, wipes, formula, breastfeeding supplies, household items, feminine care products, and the like. We have in the past done some work around food justice and getting food to our families. We've done a grant program in which we've done mini grants for our families. We've also partnered with Black Women Benefit to be able to get our moms into some group counseling. We also have a Young Mothers program that runs throughout the summer that does a lot of similar things. So I want to talk to Austin offline. But we, again, mentorship and support and kind of helping to increase autonomy and the word is escaping me, but making sure that moms are prepared and feel confident, building confidence around the motherhood journey, and just treating them like mothers because that's who they are. And so that is the long and short of it. And we are very, very grateful and excited to jump into this conversation.
Thank you so much. We have one more to introduce, Cassietta, I believe, from Mamatoto Village.
Hi, good evening, everyone. My name is Cassietta Pringle from Mamatoto Village. Thank you so much, Leah, for inviting us to participate. We have one more person from Mamatoto on as well, Rebecca Amadi. I'll give her an opportunity to introduce herself. But thank you, everyone, and all the other panelists. So Mamatoto Village is a nonprofit organization in Washington, D.C. And we mainly focus on creating accessible perinatal support services, having accessible perinatal support services here in the Washington, D.C. area. So we offer creative solutions to fighting and combating health disparities of Black and Brown women in the area. And we do that also by creating awareness, fostering spaces of resilience for our mamas and birthing bodies. We offer home visiting services through our Mothers Rising Support Services program. We offer lactation support. And that doesn't end. We offer lots of things that help to foster and build the family as a whole. And so, I think our work, everyone's work here on this panel is definitely important to helping to fix the problems that are going on with Black and Brown bodies. So thank you, Leah.
Thank you so much. And I just love that we're kind of already doing the work, right? We're getting everyone in this room together. We're making connections, which is part of what I wanted to do, was for all of us to come together. You're all doing the same work. We're all in this together, and we can't do it without a community. So without further ado, let's get started. Let's take the questions one by one, and we will go in the order that we introduced ourselves, just for the sake of ease. So let's start with this first question. Do you think the phrase Black mamas are in crisis fully encapsulates the issues around safe maternal health, or does it place blame on the victims of systematic racism?
Okay, I guess I will start since I introduced myself first. I really don't think it encapsulates everything that needs to be included, especially when you're thinking about the entire process from conception through to actually having a kid and raising a kid. The general statement of Black mamas in crisis is like so limiting to just placing the blame on the moms. I mean, I think there's a way you could say it in that more of a health crisis is facing Black moms. And, you have to be able to pull in all of the social aspects that are impacting it. And it's not just on the individuals, but it's a greater system that needs to be addressed.
Thank you, Austin.
Yeah, I would agree. I think as an organization that has a hashtag that references the crisis, I would say that I believe the word crisis has done its job as an alarm and the kind of the buzzword to get people's attention. Because I remember just a few years ago that the Black maternal health crisis was not something that we were talking about largely. And so I believe that the inclusion of the phrase Black mamas in crisis, or Black maternal health crisis has done its job as far as calling attention to and ringing the alarm. I believe that the crisis that we are facing is a community crisis, because when we lose a Black mother, when we lose a Black baby, it influences the entire community, whether we want to acknowledge that or not. The entire community is involved in the exacerbation of these disparities that are causing mothers to lose their babies earlier, causing mothers to have their babies earlier, causing mothers to die themselves and, experience more extreme morbidity. I think that as someone who believes in the power of words, I feel like I am ready to shift that narrative. I've met too many mothers who are afraid to give birth when they find out that they are pregnant because of this crisis, because of the damning disparities that Black women are facing. And that's not something that makes me feel good. I feel like Black women deserve to celebrate and be excited and expectant. And I think some of the work that we're doing as we're trying to uplift this issue has kind of hit us in the face as far as, creating this culture of fear around Black women giving birth.
Thank you, Anna.
Anna and Austin, I just want to say, well said, definitely. And Anna, just to piggyback off of what you said, ringing the alarm, and that is the point behind labeling something as a crisis. Is you're bringing it to the attention and calling it out for what exactly it is. There is a challenge, and there is a challenge that faces all of us. And while we may not see ourselves as very physically connected, there are other things that connect us socially and economically, that kind of uplift us all really as a nation, as a country. And so when we have, one woman suffering, one family suffering, we're all suffering, and we all need to see ourselves in that same boat. And so I love the way that you presented that. And, to everyone's point, no, I don't think it places blame on the people that it's affecting. It just brings it to the attention so that we now know that there's something to address. But it calls us and makes us accountable to actually start to address the problems.
Thank you so much. Wow. Okay. Off to a great start, aren't we? So let's go to the next question. What types of policies, supports, or resources would enable Black mamas to build towards liberation throughout their reproductive lives?
Can I start? I'm sorry.
Absolutely. Go right ahead. Yeah, please.
Revolution. We need revolution. I as someone who works, we do some work around policy work here in Maryland. And I'm always hopeful that policy will be supportive of the lives and livelihood and the health of Black women. But we don't have a very strong history of policy and politicians and government doing that work for and with us. So I think that I think that we need to get very clear about what we want. I think it's very easy to say we want, it's very easy for allies to say, oh, we want to be helpful and we want to dismantle this and we want to, right? And then people outside of the actual population as being most affected can say all these things about what they want. But we need to be clear about what that looks like so that people can actually follow through, because that looks like a sharing of power. That looks like a stepping back and a return to service. That looks like an uplifting, a funding, a release of funds, right? And so, and really kind of tearing down the institutions that have created this crisis, right? This issue. These disparities have been present since antebellum slavery, right? We're just now talking about them because Serena and Beyonce, but these things have been happening since they started looking at the data after slavery. And so we need a little bit more proof in the pudding, and there needs to be a stark shift in leadership and approach that puts it back into the hands of the people that are most affected, that we get the most benefit out of shifting the focus. I love having allies, but allies to me mean stepping back and being of service, not standing up and taking up space. And I think that we really need to sit with that and get uncomfortable with that, because you can say, oh, I want to give up power and but when it actually comes time for that, I've seen too many people tighten their grip when they promise to loosen it.
Thank you.
Yeah, that was really wonderfully said, Anna. I'm a little speechless. I mean, I think that you make a really good point also of we need to be focusing on the community's voices, and the problems can't be solved just through policy at the political level. Like, we need to be making sure that the policies that we're trying to put into place are actually reflective of the problems that this community is experiencing. And I think that oftentimes when you get to the level of policy, a lot of the voices of the community get lost, and things, get changed in order to fit within a certain bubble. I mean, I think it's really interesting politically with Momnibus, and the fact that unfortunately it came out right around COVID. And so a lot of funding that was potentially going towards that ended up going towards COVID. And some of the things that were included in it kind of got brought in under the Build Back Better bill. But it got kind of overseen. And now I wonder how much are we going to be able to go back to the issues that was trying to address, and making sure that the community's voices are still being heard in regards to that.
I'm sorry, I was just so enthralled with what you all were saying. I'm like, yeah, but we need to really think about that. Funding is kind of the huge elephant in the room right here, right? Just funding, but also legislation that starts to direct the funding into the correct areas and funnel everything where it should go. But funding where? We need to really think about what areas are being funded that really do affect us as women, us as family childcare providers, and family planning is one of the areas that should be highly funded. Not just the planning of it, but educating, how do you envision having your family, this year, then or within the next few years. Funding for reproductive health, and not just here's a little bit of education, here's a little pamphlet that will push you off to the side, but something that is all encompassing. What does reproductive health mean for your family? What does it mean for your personal finances? What does it mean for your education and the children that are coming up, or maybe even the children that you already have? What does it mean for your partner and or partners who are involved in this process with you, and making sure that there is access for them as well? And so, there's this level of equity that we really have to consider when we're talking about the funding and where these streams are going to go.
Can I piggyback on that?
Please.
Really quick. When I'm hearing funding, and forgive me, I'm a little burnt about this, but when I'm hearing funding, I also want to highlight funding means grassroots organizations doing the work, not large institutions that are stealing the ideas of grassroots institutions that are doing the work.
Yes, Anna, yes.
So, giving a hospital millions of dollars to do a doula program when there are 3, 4, 5 doula programs in the city is not the correct way to give funds into the issue. That's not going to help the issue, because now you're paying nurses to do an additional job instead of accessing the community that you have around you to do the job that their heart is in, to do the job that they are trained for, and to do the job that they wish to do for their community. And also, doulas need to be recognized as medical professionals that are allowed in the hospital, whether COVID is happening or not. Doulas are a resource that needs to be there and remain there, that help not only the mom, the family unit, and the medical staff that are taking care of that mom as well. I'm off my soapbox, I'm done.
We love the soapbox here, you know? Thank you all so much. So next question is, how can community-based care overcome the barriers to racism in the maternal health industry?
Didn't Anna just say it? She just said it. I think she completely answered that. Get into the community, and the community has the answers. If someone has broken a toenail, right? You don't say, well, let me try to figure it out. Tell the person, how would you like to work on this? What do you need in order to fix this broken toenail? Stop going to the people who are not suffering with these challenges or who are not going through these challenges. Ask the community, get in the community and say, what is it that you need? And if someone doesn't know, then we can offer solutions and ideas. But at the end of the day, they need to sign off on that and say, yes, this will work for us, or no, this won't. Having forums where community, people in the community can come and talk and say, this is what we're going through. And these are some of the things that we want to talk about, so they can be a part of the solution. We all need to be a part of our own solutions, and we don't need our voices hampered or shut down or shut up or bought off either. So making sure that we get into the community, but also making sure that every aspect of what a community member needs is managed. So it's not just about managing the physical. There are social needs. There are mental health needs. There are all these other pieces that kind of go into the pot and into the table. And we can't just focus on one. And I think that's what the beauty of a community-based organization is. We don't just focus on the one. We look at a person as a whole being, and we look at their family as a part of that as well.
Yeah, I think both of you guys have said it wonderfully. I would also just add that I think there's an aspect of empowering the community and providing women with the resources and knowledge and education so that they feel empowered and able to make decisions for themselves, with the background of understanding the process and understanding. So yeah, money needs to be funneled into education and just making the community aware of resources. Like, how many women don't know about doula services, and how can we get that to those women when this is such an amazing, impactful way to help in the crisis? But yeah, I think just there needs to be a sense of empowerment within the community, which I think can happen in kind of the ways that you guys were both talking about.
Right. I think to add on to what's already been said, I want to double down on the idea of the continuum of care, that especially someone that is on the perinatal spectrum, there's not a drop-off point or a specific pickup point, right? Like, there's a continuum of care. There is the social determinants of health, the things that are surrounding that mama, that parent, right? that family. And so I think doubling down on the idea that we need to really pay attention to all aspects, the entire holistic picture of what bringing another life into this world looks like, right? And then also, I'll venture to jump back up onto my soapbox and say, people who are in constant need are stressed out. So if we were to have gun rights that protect our damn children in schools, right? If we were to have, if the inflation were to be halted if we were able to make the money that we need to make to sustain our living situations, our lives, right? If we had everything we needed, what would that look like? Like, I know I would be a lot less stressed, right? If I didn't have to worry about, and I think at the crux of it is, even to do the hard work, even to do the grassroots community work, in order to be effective, you kind of have to sell your soul a little bit to capitalism to make sure that you're doing what you need to do to remain present for your community, right? And so we all have to do it in some way, shape, or form. But if we were to just give the people what they need, all of the people, not the 1%, not 10%, but all of the people what they need to survive, right? To feel safe in this country. I think that would be a start. And again, getting out of my womb, stop worrying about what I do or don't do or when I'm going to do it or how I'm going to do it. So all of those things need to cease immediately, because police brutality is a reproductive issue, right? A reproductive rights issue. If I can't give birth to my Black sons in the other room without being fearful of what's going to happen to them when I let them go outside to play, that's a reproductive rights issue, right? If I can't send my children to school, if I have to homeschool and run 2 businesses because I'm afraid to send them to school, because the school systems can't protect them, because the country refuses to protect them, that's a reproductive justice issue, right? And so I think outside of all of the other things, all of the fixes that the geniuses on this call could do to make sure that we're protecting families, right? I think we could start really at the beginning with just treating people like humans and giving them the rights and the protections that they deserve so that they can live and thrive in this country.
Thank you. Thank you so much, everyone. This is phenomenal. So let's talk a little bit about policy change. So the Pregnant Workers Fairness Act empowers Black, pregnant, and postpartum workers to receive accommodations in the workplace. Do you believe that any impact will have any impact on Black mamas? At why or why not?
I can start on this one. I definitely think it will have an impact, especially when you're looking at the types of jobs that are typically held in the community and that put women at risk that are already at a higher risk for maybe complications, but then their job puts them at even a higher risk. And not only are you worried as a mom about being pregnant and being able to pay your bills, but if you lose your job while you're pregnant, the possibility of getting a job back after you have a kid, how is that going to happen? I think something that YMI really works on is providing young moms with the tools to be financially independent, and provide opportunities to upskill and work in maybe jobs that might be a little bit easier physically, so that we can protect our moms and make sure that they are staying healthy. I'm not sure that that's going to be the fix exactly, but I think it's a step in the right direction for sure.
Yeah, my big mouth. Leah, not Leah, I'm sorry. Cassietta, do you want to go first? Ms. Cassietta?
Why, so you can drop the mic on us every single time? Yes, girl, go. Let me go first.
That is not what I'm trying to do. I'm trying not to talk too much.
No, but everything that you're saying is so valuable. Everything that Austin, that you're sharing is so valuable. And in terms of this PWFA, it is a lovely theory, isn't it? It's such a lovely theory, and it's lovely that it's been brought to the table, and it's lovely that the government has it. All of those things are nice, but is it really going to have an impact where it is needed? Exactly. What are where is the safety net really to make sure that these legalities are enforced? To your point, Austin, you mentioned that, these, the certain work, certain occupations that some women will have that may really benefit from this. But again, where is the safety net to make sure that these organizations that are employing them are actually going to do what they're supposed to do? I want to think about right now, women who are immigrants and who are working, perhaps getting paid under the table. Doesn't mean that they shouldn't benefit from this as well. They definitely should. Or how about, 1099 employees, right? You kind of getting paid cash on hand, to do a gig job or something like that, but you should still have the right to this. Let's think about some of these rideshare companies and food delivery companies where women are getting jobs because they need to fill in the gaps and make ends meet, and or maybe they're caring for other children. It works within the in-between time while the child is in school. How is this legality going to affect them, and who is going to enforce that it needs to work? Even for, I'm thinking of these temp agencies, and a lot of times temp agencies are like, we don't actually have to abide by these things, these rules. Who is going to make sure that the human resource managers know what the new legalities are and are being accountable and holding the employers accountable to that without making a woman feel like she needs to step down from a position? Too many people are afraid to speak up. They think, well, I don't want to shake the boat because I don't want to lose my job. I can't afford to lose my job. Who's going to manage my household and take care of my children? And who's going to cover this market rent that I can't even afford in this dilapidated building, that's overrun with roaches and rodents? Like, who is going to manage all of that for me if I end up having to, say, hey, I'm going to stand up for myself and I'm going to take what is legally mine that the government is saying? At the end of the day, they could lose their job in kind of a covert way. Maybe their hours are cut at first, and it's just like, oh, we just really don't have the staffing or the funding to pay all the staffing, so we're just going to cut back on your hours. And then things kind of escalate from there. Who is going to protect them and make sure that this law is really enacted? Like, how soon is it going to be able to trickle down to the people who really need it?
Shay, and as I'm listening to you, I'm also thinking about the fact that legal repercussions or the privilege of being able to lean on the legal system to advocate for you is a privilege. And a lot of these families, even if a mom was illegally let go or something like that was proven, they oftentimes don't have the money, the resources, or the time to even advocate for themselves or have someone advocate for them in that way. And so that's what I'm thinking when I'm listening to you talk about that. And then also, I think we need to really get real about paid leave, right? Like, for everybody. But like, I think that we're like creating these things that are dancing around the larger subject or a larger topic. And it sounds beautiful in theory. Again, like Sis said, in theory, it looks like a beautiful utopian way to handle things. But unfortunately, we know the history of this country is that is not usually the case. And so I'm hopeful. But I also know that there needs to be other supports and legislation that kind of props it up as well if we're really going to try to see some positive outcomes from that work. I just set the mic down. See, I didn't drop it, just set it.
I just wanted to say, I'm really glad you mentioned, Anna, like paid family leave, because as we were talking about it, that was kind of what also was going through my mind of like, this is great, but I don't know, is paid family leave even more important? And maybe we should be focusing our energy on that. But then, I mean, there are plenty of other issues in there too, of like, how does it work for hourly employees and all of those things. But I think that's definitely a big thing that's being just like left off the table in the discussion.
So our next question, share some community building practices or techniques that can be used to uplift and unify Black mamas across the African diaspora, Black women's voices, perspectives, and thought leadership matters as related to hashtag Black Maternal Health.
I'll go first. So I think, so first of all, as far as practices, there are two different practices or resources that come to mind. Number one is the NAP ministry, and the idea of rest is revolution. And I think having had 2 children and been pregnant, mama needs naps, like that's, but also really normalizing and supporting the idea of rest, especially Black women who feel like we have to be 10 times better than everybody, super women, Black girl magic, all of those things. So I would encourage people to look into the NAP ministry. It's definitely has been beneficial to me and my staff and our mamas, just kind of as a reminder of, you don't have to do every single thing, and you can let the text message go. You can wait for the email until Monday. Like the world will go on. And then also Adrienne Marie Brown, which she wrote a book around strategic somatic work and strategic planning and strategic work. And of course, the title is gone from my brain, but also she wrote a book called Pleasure Activism, which says, you know, us as practitioners, we need to be able to fill our cup and to feel good and to be able to be joyful and engage in pleasure, because this work is hard. And so I think that those two folks are things that I personally lean on a day-to-day, resources that I personally lean on. But then also, I mean, I think we're here, right? So we've got Black Women Benefit that's hosting this panel, right? Mamatoto Village, who I just, sent some folks their way earlier this week, right? Like Ancient Song in New York, National Black Doula Association, also based in New York. Like there are organizations that are doing the work, and I think us just gathering and uplifting each other and resisting that capitalistic idea that we can't collaborate without there being some competition is the most important in being able to continue this work and be supportive of our communities. And then also just trusting Black women, right? Like my mamas tell me what they need. I might come in and be like, oh, we're gonna do this and some yoga and some Reiki. And they're like, no, girl, I just need to talk about how so-and-so left a dish in the sink last night and I'm angry about it. Like our listening is a very underrated tool in creating trust and community within ourselves. And I think that is one of the more important things.
Yeah, I would say just to piggyback off that, one of the programs that YMI runs is called the Just Listen campaign, and it's all about bringing moms together to just talk about whatever they want in a judgment-free zone, and build a community for themselves. So I think by providing a place for women to come together and talk about the issues and provide each other support, that automatically provides like some sort of lift. And so providing those opportunities, I think, is really key, and providing them throughout, the maternal health cycle of like from preconception through having kids and watching them grow up and all of that. Because there's different issues that are going to arise and you're going to relate differently. And so like those conversations just need to be happening.
And I think something that Mamatoto Village has done from the beginning is we hire women from within the community that we're serving. And that is so vital. That is so important. Most of our amazing, amazing birth workers and health and wellness coaches and lactation coaches come from Ward 7 and 8, live right up the street, could be your next door neighbor, and so that kind of extends the hand of, being your brother's keeper or treating others as you would want to be treated, because you already know what they're going through. You literally are walking in their shoes every single day. We also have focus groups that our data team puts together where those who have been supported and served by us can tell us, hey, actually, this was great, but what I really needed was XYZ. And what I would really love to see is XYZ happen next time. And we take all of that into consideration and we change. We add more or take away things that are not helpful anymore. But all that to say, we just get in the community and find out what is it that you need. But also, supporting change within the community so that those who are being served and supported can come on back and serve and support somebody else. And then, share the love and spread that. And I think that's one of the main bases of making sure that we know and we amplify Black maternal health, by having other Black women just do that same thing.
Fantastic. How can birth justice transform the entire maternal health industry? That's a big one, I know. Anna, I can see you waiting.
I thought I saw somebody's mouth moving, so I was like, is she on mute? But then I didn't want to come off mute. It's I'm still getting used to peopling, y'all. I'm sorry. So the question is, how can our work affect the entire landscape of maternal health, right? And I think our work would just catch us up to where everybody else is, right? Like the disparities in the numbers are such that I say this often when I'm talking to funders or well-wishers or something like that. It's like, what about white women? Or what about, my friend's pet who's got a baby? Why aren't you taking care of that? And what I say is the numbers don't lie, right? And so the numbers say that of the 700, 800 women that lose their lives in this country, the vast majority of those women that lose their lives because of birth or related to birth outcomes are Black women. And it does not matter how much money they make, does not matter how much access they have, does not matter if they are fat, skinny, college educated, none of those things matter. They are dying. And for me, that is a clear point to racism and discrimination and bias and all of the other isms. And so I would say that that's the bleed, right? We need to stop that bleed. And once we do that, I feel like the numbers will decrease dramatically. Once we start taking care of mothers and centering mothers and or birthing folks in their experience, rather, excuse me. Once we start, centering birthing folks, then the outcomes of babies will start to get better, right? And then their life expectancy will grow. I am of the mind that this country was built on the breasts, the backs, and the minds of Black women, right? And so if you want to improve that, you need to first improve the experience of Black women, because Lord knows we take care of everybody. So if mama happy, everybody else is happy. And so I think that very easily or very simply taking care of the issue at hand that is so clearly presenting itself will reverberate again, not just in the family unit, but into the community, you know, into the workplace, into the entrepreneurial structure of a community, of a city, the income, like all of those things grow. When a Black woman is smiling, everybody is smiling. Like, don't tell me you walk into a room and see somebody, a Black woman who is healthy and glowing and happy, and that glow don't get on you, right? So I think that it will just increase our ability to solving that puzzle. It's not a puzzle, we know exactly what we need to do, but solving that puzzle, fixing that issue will lay the groundwork for whatever comes up against us in this arena, because Black women are present and the disparities of Black women are present throughout the reproductive justice landscape, throughout the perinatal experience. And so I think we gotta fix what's bleeding first, and then we'll be able to stand up straight.
Well, I'll go. Yeah, I like that. You should make that what do you call that? A hashtag, fix what's bleeding. Our uteruses are bleeding, right? Bleeding for our children, bleeding for our communities, bleeding for just basic human rights. And I think that's what birth justice is. It's just a basic human right. Your right to live, your right to bodily autonomy, your right to walk down the street without being harassed, your right to justice-centered healthcare, just all of these things. And also, you know, it's important that, I'm going to cycle back to it because I said it before, these community-informed kind of models of healthcare are really important. That's going to start giving this equality towards justice-centered care, and you know, just making sure that the community has a say in everything that we do, and just kind of, you know, helping people to understand literally there's everything that we do, from rising food prices in the grocery stores, rising gas prices at the pump. All of these things affect our basic human rights to be able to care for our families, have shelter, and even make a decision on whether or not we want to have families. Access to products to manage our menses, you know, access to birth control. All of that encompasses birth justice and human rights. So if we can get back to being more humanistic in our care and our approaches to the legal system, that would be great.
Yeah, I mean, I think it's really hard to just pull out birth justice and not also then be talking about human rights, reproductive justice, women's rights. I think they're all so interconnected. And, you know, if we can start having from birth, there be like an automatic, you know, like you're coming into the world in a just way and there's all of that already surrounding you. I feel like from that point, we can continue to create a community and like where birth justice is reproductive justice, is women's like rights. And it's, I think right now is a really difficult time for having that conversation and really focusing it on what's happening. So, you know, I think also just having the conversation of most people don't know what that means either, birth justice. So let's start by also getting the public aware of what's happening, and just of that terminology, I think is really important because many people are coming in being like, what does that even mean? And what are we doing about it? Or why are we doing something about it? So sharing that knowledge.
Thank you. So let's talk about reproductive justice and reproductive rights. That's a perfect segue into this next question. So on this on this call, we've said multiple times that reproductive rights and access to contraceptive care are part of the birth justice movement. How can we as a community support reproductive rights and reproductive justice as part of birth justice?
Well, I hadn't considered this before, but I think to Austin's point is to make sure that people actually understand the definition of that, that they understand that there is, the question of autonomy over one's body and a person's own personal choice to have children or not, to engage in sexual acts or not. And then if they do choose to have children, their right as a human to be able to sustainably afford and manage their children and their households and really take care of them without it being this huge burden. And really, I mean, we can't really have this conversation without talking about and bringing up this whole issue that's happening with abortion rights. We can come at it from several different standpoints, from legalistic to humanistic to religious, and it doesn't matter, because at the end of the day, what we're talking about is a person who has a uterus, who can carry a baby, being told by someone who has absolutely nothing to do with that they must carry that baby, but then also being told that, by the way, if you do have this baby, we're not going to help you. There's nothing set up in this system really to help you and support you. We're just going to sit back and wait so we can snatch that baby away in case you happen to fall off the bandwagon. That's not justice. That's not righteous behavior. That's not helping your fellow man.
Yeah, and I mean, I think along with that, if you decide to have a child, carry that child, you should also then know that that experience is not going to result or have a higher risk of you dying just because these resources and things are not happening. Like, if you decide to have a baby, it should be under the idea that this is going to be a wonderful process. And at the end of it, I'm coming out with a healthy child and I'm healthy. And right now we can't guarantee that. So there should be absolutely no reason that anyone's telling you whether or not you should be allowed to have or not have a kid.
Yeah, I think what's been said has been said, right? Like, I also am thinking, and it's late, so maybe that's why my brain is doing what it's doing, but I'm also thinking about the fact that right after chattel slavery ended, the prison system began, right? And so there's been a lot of work around and a lot of outcry around the treatment of Black people in that system. But what happens if we have a number of unwanted babies that are not being taken care of, that don't have someone to sew into them about their worth? And so my fear is, if this actually continues in the way that it looks to be, what does this mean about, another class of folks that are at the mercy of the haves, right? Like, and again, my brain might just be doing flips because it's late and I'm thinking about bath time, but I'm not naive enough to think that this is about a moral standpoint, right? That there is some type of a plan or some type of a plan of action that will come from and be born out of, all pun intended, this right being taken away. And then I also am thinking about the idea that I've heard a number of my colleagues and my friends and my cousins and my play cousins saying, oh, well, reproductive justice, this abortion stuff, that's a white women. White women are the ones that they're trying to get. But when you look at the numbers, Black women have the highest number of abortions in this country, drastically higher. And also thinking about how access to that support that Austin was talking about plays into that role and plays a role into that decision that is very difficult and is not an easy way out for anybody. And so again, I'm thinking about, it goes back to, for me, people just having what the hell they need to live a life. And to live a life and to bring a life or to not bring a life. But like what would happen if a woman's desire to have an abortion or to not have an abortion is completely unencumbered by her access to housing and her access to food or safety or a livable wage? And what if she has the space to make that choice without judgment and actual support? And not like, oh, you should do this because, all right, I'll see you later. Like, no, like we really need to think about what support looks like. And support is not a one person deserves like, no, like all, like I talk often about the work that we do. Like there are people, mothers who might be more difficult or might be more rough around the edges or whatever, that people don't, oh no, don't give her support, don't have her in here, right? Like, no, like all people who are giving birth deserve respect, support, and help if they need it. All people deserve respect, support, and help when they need it. And I think the second we actually get real about that and make some actual plans on implementing that as the societal norm and the way that we think and approach each other, the more we'll be able to unravel out of this mess that has been made over these last centuries.